If you're a doctor, a nurse, paramedic, GP, consultant, or somebody that works in the medical field, please stop scrolling. This video is for you. My name is Jess, and I have spoken at many conferences with healthcare conferences at UK and many other organisations, mainly about patient safety, patient deterioration, and mainly sepsis. So a little bit of backstory: when I was 21, I developed sepsis through a chest infection. I was admitted into hospital through my GP, and that evening, after being admitted and blue lighted to hospital with sepsis, I was discharged. When I was discharged that evening, I deteriorated rapidly at home. A few things that happened at home was I was vomiting violently, very consistently. My eyes were rolling to the back of my head. I had no strength in me whatsoever, and I kept saying to my parents, I'm so tired, just let me go to sleep. And many other symptoms and signs that I cannot recollect. However, because of the urgency and my mum recognising that I had deteriorated rapidly and contacted the 111 system, paramedics arrived at the scene, and they confirmed with my mum, if she had not have made that call, the next morning it would have been very likely that I would have lost my life. So I was blue lighted back to hospital, and I stayed in hospital for a further 2 weeks with sepsis. The reason I speak at healthcare conferences and speak at many events is because I feel so strongly about patient safety. I feel so strongly about recognising deterioration, and I feel so strongly about sepsis awareness. And all three go hand in hand. And when I speak to doctors, nurses, GPs, consultants, one of the key things that I like to speak about, when not just focusing on my own story, because since being a sepsis survivor, and when I was discharged from hospital for the final time, I entered a recovery phase that I didn't know I was going to enter. And I didn't know about life after sepsis. I didn't know about post-sepsis syndrome. I didn't know about organisations that were there to support me if I needed it. And when I speak at conferences, as I'm telling you now, here on this video, is when a patient is discharged, it's really important that they have all the information that they need. So I'm using sepsis as an example here because that is what I have lived. I am that lived experience. When I was discharged from hospital, I didn't fully understand what sepsis was. I couldn't tell you what sepsis even done to the body. I couldn't tell you the signs, I couldn't tell you the symptoms, and I most certainly couldn't tell you that there was an organisation out there that could support me, aka the UK Sepsis Trust. I didn't know about post-sepsis syndrome and the potential effects that I may suffer with, like loss of memory, hair loss, shaky hands, anxiety, and many other signs and symptoms of post-sepsis syndrome. Too many to speak about on here. A few that I have encountered myself is memory loss. I have extremely shaky hands, and they shake maybe all the time. Sometimes very lightly, sometimes they can be more severe. But that is something that I've experienced since surviving sepsis. What I couldn't also tell you is that sepsis can reoccur, and is actually more likely to reoccur when you have survived sepsis. I have had sepsis 4 or 5 times now, to the point I cannot tell you exactly how many times, because I don't know whether it's 4, I don't know whether it's 5. And all of those times I have developed sepsis through chest infections, which is what my original sepsis developed from. So I couldn't tell you that. there were so many things that I didn't know when I was discharged from hospital. And what I think a lot of doctors, nurses, GPs, consultants seem to not forget, because you're all amazing, you're, you know, just the most incredible people, but life goes on after we leave the hospital, and for some of us life is different. Many sepsis survivors experience limb loss. Many sepsis survivors have been in intensive care for many weeks, and they still don't know about life after sepsis. And all it can take is just mentioning who is there for them, what is the recovery path, and even just a leaflet. The UK Sepsis Trust hand out, you can order leaflets from their website, and just a leaflet could make all the difference. If you're not giving it to the patient, give it to the families. Because another big thing that I have learned during my many years now in the advocacy world, and I have spoken to so many sepsis survivors, but also bereaved families, is that the families feel forgotten about. A lot of them have said to me when I go to speak at conferences and I use their story as the example, as I do at many conferences, I have used other people's stories as my example, because sometimes, and of course, there are stories that are a lot more shocking and in depth than my own, and I prefer to give them a voice and make sure that their stories are told. So I've spoken about Leon Singh, and he is one that just breaks my heart every single time, and his family know I tell Leon's story at conferences. And if you don't know who Leon Singh is, please Google Leon Singh. Google him. There was so many failures in his sepsis story. Leon Singh lost his life because of failures. But also, and just like Leon Singh's parents, there are so many individuals that feel like they are not listened to, and they are not communicated with in the right way. When a parent or a husband, a wife, a sibling comes to you and has genuine questions or queries about their loved one's condition, speak to them, communicate with them. If they are querying what you're doing and why you're doing something, respect that and answer the questions, because there are so many people that just don't feel listened to. But also, when their questions go unanswered, they feel unheard, sometimes mistakes can happen. And actually, the families, the parents, the siblings, the husbands, the wives, they know that patient better than what you do, and they know if something is not right. So the biggest thing I say at healthcare conferences is listen to the patients, listen to the families, communicate, and also communicate better with each other. I have so much to say, so much to say, and I cannot fit it in this 10-minute video. But like I said, my name is Jess. You can find me online. My name's Jessica Tuffield. I'm now Jessica Gay, but I speak at healthcare conferences. You can reach out to me. I speak at many tours, events, conferences. You can reach out to me and I'll be sure to get back to you.